Hi, I'm Lindsey, and I'm talking with medtech industry leaders on how they change lives for a better world.
The inventions and technologies are fascinating, and so are the people who work with them.
There was a period of time where I realized fundamentally my job was to go hang out with really smart people that are saving lives and then do work that would help them save more lives.
I got into the business to save lives, and it is incredibly motivating to work with people who are in that same business, saving or improving lives.
What better industry than where I get to wake up every day and just save people's lives?
These are extraordinary people doing extraordinary work, and this is The Leading Difference. Hello, and welcome back to another episode of The Leading Difference podcast. I'm your host, Lindsey, and today I am so excited to introduce you to my guest, Bethany Corbin. Bethany Corbin, JD, is a nationally recognized healthcare innovation attorney, femtech entrepreneur, and influential thought leader at the intersection of women's health and law. She's the founder of Women's Health Innovation Consulting and Fem Innovation, organizations dedicated to advancing equitable, cutting-edge solutions in women's health. Her book, The Femtech Revolution, empowers every woman to confidently navigate the femtech space, equipping them with essential tools to protect themselves and advocate for their health needs. All right. Well, welcome to the show, Bethany. I'm so excited to be speaking with you today.
Thank you so much for having me, Lindsey. I am honored to be here.
Awesome. Well, let me just start by asking you, if you don't mind, to share a little bit about yourself, your background, and what led you to medtech.
Absolutely. So I'm an attorney by background, which is not the traditional path that one would think of when we think of medtech. When I went to college, I wanted to be a doctor and get kind of into the biology and the sciences. And I realized I was actually really terrible at them. It was not where my skill set aligned at all. And I had to do a bit of recalibrating. Realized that I loved kind of research writing, learning about new things, and ended up going into law from there. When I first went into law, though, I was actually in financial services and litigation. So it was like the farthest thing ever from healthcare and medtech. And it was horrible. I actually hated it. And from there, I ended up getting a clerkship in DC. And that gave me time to really consider what I wanted to do after that clerkship ended and really where I wanted to focus my practice. I have been involved in healthcare since I was 8 years old. My mom actually had an illness where doctors continually dismissed her. And so it took us 7 to 8 years to get a diagnosis. So I had a lot of background with healthcare, then had a lot of background in healthcare with my grandparents getting sick. And so for me, healthcare was always something I was really interested in. And so I started to look into health law. I actually, at the time that I was doing my clerkship and going into my next job, was doing a healthcare LLM. So essentially a master's degree for lawyers in healthcare law. And I ended up transitioning into healthcare law from there. I was doing big law in Washington, D.C. at the time, doing your traditional healthcare things, right? Like your managed care, pharmacy benefit management, all of those kind of things, some healthcare privacy. And it was great. And I actually got the opportunity to teach law at my alma mater. And it was while I was there, it was in 2018, that I actually came across the term femtech for the first time. And I had never heard this term. I got really interested in it, really excited about it. And I started focusing my research portfolio and scholarship on femtech. So I went and did my first conference on femtech, wrote my first paper on femtech in that time, and really started to see the impact that this could have on women's healthcare going forward. So I actually left teaching, went back into big law in order to focus on femtech. And while I was there, I realized that a lot of the companies that were creating these products were startups. And of course, in big law, you're not really working with startups, you're working with those larger corporate institutions. So I actually left big law, went to a smaller firm where I could start and focus on a femtech practice and work solely in digital healthcare. And I absolutely loved it. I got a lot of expertise and knowledge. And then from there, branched out into having my own firm focused on femtech and working with early stage founders to help them bring their products to life to revolutionize women's healthcare. So I know that's a long roundabout way of getting there. I'm now running my own firm, and I have a book on femtech that's coming out this fall.
Oh my goodness. First of all, I love hearing the background and the winding path that led you to this incredible calling. And I would love, so many things stand out, but let's start with your book. Can you share about that? Because I am personally very excited about this, and I would love to hear about your journey and writing it, and then what's it about and how can we even get a copy?
Yes, absolutely. So it's so funny, right? Because if you had talked to me 3 years ago and told me I would write a book, I would have said that you were crazy. And it's interesting. My book is called The Femtech Revolution. And it's really about harnessing digital health tools to improve and help to transform and revolutionize women's healthcare. Because for so long, women have been left out of the conversation about healthcare. Our bodies haven't been studied. There's a lot of disparities that we have and a gender data gap that we have when it comes to women's healthcare. And this has continued today. When my mom, when I was 8 years old, she was continually dismissed by doctors and told it was in her head. Coming full circle, I had my own women's health issue very unexpectedly in 2021, and my pain was actually dismissed and mismanaged with my surgical team. And so seeing that occur in today's environment and how little we've grown in women's healthcare and innovation over that time period was something that for me was really a driving factor, not only in my transition to femtech, but also in writing this book. Because there's been studies that have shown that about 89% of women have actually never heard the term femtech. And yet it's this entire multi-billion-dollar industry that's being created for us, but we don't know about it and we can't get access to it because of all of the censorship and stuff that happens online. So we don't even know this exists. These tools are being built, and then we're not seeing a lot of investment or adoption into the tools because we don't even know they exist, so then the companies can't get the consumers that they need. And of course, we're also living in a time in which we're in this post-Roe versus Wade environment where I'm sure people remember there were a lot of calls to delete your period tracking app and things like that when the Dobbs decision came out. And so when I've been working with startups, I always do it from a very consumer-centric perspective, which is we want to maximize privacy for consumers. We want to give them accurate tools and devices that they can use. And we want to be promoting health equity so that these tools can be available for women regardless of their income and their status, their circumstances. And as I was working with startups, it dawned on me that there's actually nothing out there for consumers and patients telling them, A, this industry exists, but B, how do you navigate this industry with all of those considerations in mind and avoid these products that are probably just going to be fake products, right, or inaccurate products, and they're actually going to do more harm than good? There's nothing that tells consumers how to navigate that space. And so I thought I'm going to write the guide for how consumers can vet these products in under 15 minutes and how they can navigate and understand this space. So that's where the Femtech Revolution came from. It is a playbook for women to not only understand background of women's health, how we got here, why we're being neglected, but also to then say, I want to use these digital tools. Here's how they can help me in my health journey, but here's how I vet them. I created a 4-step framework for vetting products. It's called my SAFE method. So it vets them based on security, accuracy, foundation, and equity. And it's really focused on making sure that you as a person and a consumer are choosing products that align with your privacy goals and your security goals, so your health data is not at risk, that you're choosing products that are accurate, and how you actually tell that for products that claim they're accurate but actually have no scientific backing. It focuses on foundation too. So looking at who is comprising the company, right? What are their values, their goals, so that you can make sure you're supporting companies that are in women's health for the long term instead of just to profit off of us. And then of course, equity, right? Making sure that we're choosing and selecting solutions that are going to be usable by the majority of women, regardless of racial, ethnic status, income status, any of that. We want to make sure that we are developing products that have the core of women's health in mind. So that's really what the Femtech Revolution is about. And it's just about empowering women and showing them how to navigate this space in a way that's never been done before.
Wow. Well, I am so excited for this book. I cannot wait to get my own copy. Are you doing pre-sales right now, or how is this working?
Yes, the book is available at all major booksellers right now. Amazon has it, Barnes & Noble, Books A Million, and then for companies or individuals who want to purchase bulk copies, there's actually a way to do that through Porchlight that gives you a discount. It comes out September 23rd, but if you pre-order, you'll get a signed book plate and you'll get all of these other resources that I'm creating kind of behind the scenes to actually complement the book. You'll get all of those in digital form free because of the pre-order. There's a link on my website. If you go to femtechlawyer.com, there's a book section and there's a form there that you can complete after you make your pre-order, and you'll be signed up to get all of those great things.
Excellent. Oh, this is so exciting. Okay, awesome.
It is, and I will say it was so far been a #1 new release on Amazon for health law. And it was also listed in Publishers Weekly in its preview for fall book alongside books Dr. Sanjay Gupta's that's coming. So it is getting some attention, which I'm very thankful for, because we really need to drive awareness to the space.
That is amazing. Congratulations. I'm sure this is just the beginning of its success, and I cannot wait to see where it goes and how it changes lives and improves so many women's experience with healthcare. So thank you for writing it, and congratulations on its success already. And it's just the beginning.
Well, thank you. I'm so hopeful. The goal is really to get this in the hands of as many people as possible, just so that we as a collective group have the power to change women's healthcare if we act together. And so this book is really kind of that rallying cry for saying, if we're not going to do it now, are we ever going to do it? Because we have the resources, we have the momentum for women's health right now, but we have to band together to show our interest in this industry.
Yeah, absolutely. So on a very practical side, what are maybe just a few key things that women can do to advocate for themselves in a situations where they are being dismissed? Their symptoms are being dismissed. People aren't taking them seriously, or they're like, you don't know what you're talking about kind of thing. So what are some of the just very practical things that women can do in order to advocate for themselves?
Oh, absolutely. And we also have a chapter in the book that focuses on Femtech, specifically how you can actually take your data and use it to advocate at the doctor's office. So I'll go into some of those tips as well. But, kind of from a high level perspective, the first thing that I always recommend is, if you think that you're going to be dismissed at all, take a friend, a family member, or call the clinic and see if they have a patient advocates council, and take a patient advocate with you, because you're much less likely to be dismissed if you have somebody there with you at the appointment whose job it is to advocate for your needs. And I found too that women are a lot less likely to be timid and kind of shy and sit back in those scenarios when you have another person, because if you don't speak up, they're going to, and that adds just a little bit of empowerment to that office visit or the doctor's visit. So that's kind of the first thing. If you ever feel like you're going to be in that situation potentially, bring someone with you. It's another set of ears as well. If you are dismissed, you've got somebody there who's able to back you up and support you if you needed to make a claim out of it. So that's kind of the first thing. The second thing I always say too is make sure that you're taking your own notes, whether it's at the visit or right after the visit. Be careful about using apps like Notes or things like that from a privacy perspective, right? You want to have either an app, right, or a piece of paper that is going to be protective of your privacy and not upload all of your health data into some cloud system without encryption. So just keep that in mind. But make a note if you felt like you were dismissed in the doctor's office about everything that happened, your concerns, how they were addressed, and make sure that you keep that paper or that application or note somewhere where you can access it if you need to, if you end up having an adverse health event down the line. The next thing that I always say too is, if you are dismissed in the doctor's office, don't just accept it. Ask why they're not proceeding with additional testing. And if you think that there's a particular test that you would like to have and your doctor continues to say no, or they continue to refuse to do any type of follow-up, ask if they'll refer you to a specialist. You can say something that's very simple, like, I understand that you're not willing to look into my condition any further, but I feel that further investigation is warranted. Can you please refer me to a specialist who may have more expertise in this area? If they're unwilling to do that, the other thing that I also always say is make sure that they put a note about the dismissal in your medical record. And a lot of doctors are going to be very unwilling to do this, and it can cause them to reconsider. So I always tell patients, say, can you please note in my medical record that my concerns, desire for additional testing, were declined by you? And oftentimes that will be enough for doctors to take a step back and say, do I really want that to be in writing in a patient's medical record from a liability perspective? And it can cause them to give you that extra testing because they don't want that dismissal noted in the record. If they don't, then you've got that dismissal noted in the record, which can be very helpful for you going forward if you ever needed to pursue a claim. And then the last thing I will say is, as women, a lot of times we are very, we want to be seen as getting along, right? We want to be friendly, right? We want to believe that our doctors have more knowledge about healthcare and medicine than we do. But only we know our bodies. Only we know how we're feeling. And so if you're continually being dismissed, there's something in your body is telling you that that's wrong. Listen to it, push back, and get a second opinion. Go to another doctor. Don't be afraid of being seen as confrontational or difficult or things like that, because in the end, it's your body, it's your health. And if you have something that's seriously wrong and it's not caught, you're unfortunately the one who's going to pay the price. So remember that it's not about being difficult or confrontational. It's about saving your life.
Mm. Oof, that is powerful. And that is great advice. Thank you so much. Even just listening to just that snippet, I feel personally more empowered to have those kinds of conversations with my healthcare providers if and whenever needed, because I feel like I have better tools and even phrasing. So thank you for sharing that. I think that's really helpful. Yeah.
Of
Um,
course.
so to your legal side of things, can you share what do you do right now? How are you helping in the femtech space, these different companies that are really in need of support from a legal perspective? What is your role in that and how do you support those folks?
Yeah. So it's interesting because whenever I worked at large and smaller law firms before I branched out onto my own, one of the things I continued to see was early stage companies really kind of, they had their idea right there somewhere between ideation and their Series A fundraising round. And they would come to us for legal advice, but they wouldn't have a ton of money. And we would have to turn them away and would say, we get it. You're not ready for us yet. Come back when you have X amount of money and we'll help you. And when they would inevitably come back at that higher price point, we would say, great, here's 10 things you've done wrong in the interim. And now it's going to cost you double the amount of money to fix that. And that to me was heartbreaking, because so many of those things could have been fixed early on. And nobody was really providing that support. So I found a gap really for these early stage companies who needed legal support, but really didn't have a lot of places to turn. So whenever I branched out with my own law firm, what I did was I actually specifically chose to focus on those companies somewhere between ideation and Series A fundraising round, where I could guide them through those startup phases in a way that was not going to be cost prohibitive to them and would allow them to get that early foundation set so that they could grow, scale, build, get excess capital, get investors, all of that type of thing. So my role, it's interesting because it straddles two lines, right? It's of course legal advisor, but also there's a bit of kind of business planner in there as well with them and helping them conceive their ideas, right? Helping them kind of think about which features work or don't work from not only practical perspectives, legal perspectives, but consumer perspectives as well. And so I get to wear a lot of those different hats. So on a typical day, I might do anything from advising clients on corporate structures, how they want to set up their business. Is it a corporation? Is it an LLC? Working through those equity issues, how you think about equity for co-founders or for investors or for your employees. And I do a lot of that. I do a lot of setting up very specific corporate structure models. There's actually a lot of corporate practice of medicine laws out there that prohibit individuals who aren't doctors or medical professionals from owning companies that provide medical services. And it's very interesting because oftentimes the people who want to build these companies and make money are not the doctors who would be providing the services. Investors, for instance, are not doctors. So there's a very interesting corporate structure that you can create that gets around that in most states. I do a lot of that to help my companies stay in compliance with the laws. I also do a lot of privacy work. So I have several privacy certifications, and privacy is one of the key areas that I'm very passionate about. But I help companies with everything from their privacy policies to disclaimers to thinking through how their different features in the app could compromise privacy and kind of everything in between there, security, cybersecurity, and really working with them to think about it from a consumer perspective. I actually am selective about the clients that I do take on because there are so many companies out there that want to prioritize money over the patient experience. And so I'm very cautious to work with clients that want to make sure that they're doing things right and really wanting to make sure that they protect patient privacy. I do a lot on the patient privacy front. I do a little bit on the fundraising side with my clients as well. And then, of course, everything from contract drafting and negotiations, I do a lot of that as well. And I've actually co-written a book on contract drafting before.
Oh my goodness. So, okay, first of all, that's awesome. I love all of this. And, I was thinking as you were talking, I was like, oh my goodness, I love how you're helping your clients. And I love your passion for especially helping clients succeed who they are about more than the money. Everyone has to make a living, so that's important too. But I love the fact that your heart is for those people who are so invested in actually changing lives, and that's their primary driver and motivation. I think that's really powerful. And then, listening to you talk about this, I'm like, okay, so you've got this amazing, probably more than full-time opportunity. You've written a book, and then so you're also CEO of Fem Innovation and a mentor with Femtech Lab?
Yes, I did a lot of mentorship through Femtech Lab. They were kind of an accelerator program for Femtech companies. And I've worked with other accelerators over that time as well. So it's just the pro bono advice that you're able to give to some of the early stage startups across the world, throughout their early stage journey through those programs, which has been really great and fascinating to work with. And then through Fem Innovation, our focus is a little bit different there because we're focusing on both startups and medical professionals. We actually have a course that we've created that teaches clinicians and healthcare professionals about Femtech, how to get involved in Femtech, and how they could be using those tools to actually support patient care and help empower their own patients. Because there's such a lack of knowledge, even among clinicians today, that Femtech exists and how you incorporate it, especially if we're thinking that there's so many tools out there and the risks associated with that. How do you know which ones are appropriate as a clinician, that type of thing? We've also seen a lot of clinicians wanting to get involved with Femtech companies as advisors or even as their boards or coming on as medical professionals in those companies. And so some of the courses that we've done before have been focused on that as well and helping them interact and get those roles with Femtech companies. So we kind of see ourselves at Fem Innovation as an ecosystem builder. We obviously have the legal side, but now we're bringing in the clinicians, getting them integrated into this, getting them connected with the startups because it's their industry. This is what they're working on. But there's oftentimes such a disconnect with the tech companies building the products and the healthcare professionals. And then we do offer some other additional non-legal resources to founders as well.
Wow. That is incredible. Good gravy. I love your heart for all of this. And I also am like, I don't know I think you must have a superpower of like squeezing more time into your day somehow. You just add hours miraculously.
It's so funny. Whenever I worked in a firm, a couple of my colleagues would come to me. They're like, how do you get everything done? Like, there's got to be 10 of you because how are you doing it? Honestly, it's just because at this point I don't have kids. And so I'm kind of able to really devote all my time to work. But but I get such fulfillment out of it too, because I really feel like we're pushing an industry forward in a way that hasn't happened before, and getting to see all the new companies come into the space, the new organizations that are supporting the companies. It's been really heartwarming to see all of that. And, on the horizon, we're also hoping to loop in the consumer side a bit more as well. Obviously, the book that I've written is very consumer focused. It can also be used, by clinicians or by startups who want to make sure that they're doing the right thing. But to date as well, there also really isn't a single location for consumers to go to find all these companies. And we have so much censorship that happens that unless you know exactly what you're looking for, you're probably not going to find the companies that are out there to serve you. And so we have a partnership that's in the works right now to actually build a database of all those Femtech companies and products and have them vetted to a certain extent, or information on there to a certain extent about clinical accuracy and privacy and those things that I talk about in my book. So that's kind of the third component that we'll be weaving in later this fall.
Oh my goodness, how exciting. Oh, I'm so thrilled about all the work that you're doing to push this industry forward and to really make a difference in women's health. And, you're such a thought leader in this space. What was it like stepping into more and more leadership roles to the point of leading your own firm? What was that journey like for you?
Scary, I will say. It's interesting because I've always thought of myself, kind of as somebody who could be the backbone of a firm, meaning that I do a lot of like the behind the scenes work, right? A lot of the legal research and writing. And that's kind of what I had made myself in at Big Law and, also in the smaller firms that I worked with. Whenever I decided I was actually initially going to take a break before, starting my firm, I was going to take 2 years off. I lasted 5 months. Oh, no, I'm sorry. I lasted 5 weeks, excuse me. And by that point in time, I had clients knocking down my door saying, where did you go? We need this kind of help. Nobody's out there providing it. And so that was kind of the impetus to say, okay, I'm going to start the firm earlier, right now. And I'm going to also look at kind of this ecosystem building, because of all the pain points that we were seeing. And so I will say I went into it probably unprepared. I never, if you had told me 3 years ago that I would have my own firm, I would have said you were absolutely crazy, more crazy than me writing a book. And I'm very glad I did it because there's something to be said about kind of plotting and planning your own trajectory and, being able to pivot with your clients instead of having layers of bureaucracy that you have to go through. So I have loved it from that perspective. I will also say it's definitely been the most challenging thing that I have done because as a leader, you're responsible for all the decisions. You're responsible for the trajectory. You're responsible if you're not making money. And, there's, of course, that fine line, right, between philanthropy and making money and walking that whenever you are really, really wanting, to help every single femtech company that's out there can be difficult. So I would say that can be a little difficult sometimes, and making sure that you have the right support system to actually allow you, to bounce ideas off of them or get feedback, and being able to pivot when those initial ideas don't work. That's been something that's been really critical for me, is pivoting. This really isn't like the first time, this isn't like the first idea I had for fem innovation and things like that. So being a leader is definitely challenging, and making sure that you kind of develop your own leadership style and leadership, capabilities as well while you're through this journey has been something that I've been working on too.
Yeah. Yeah. And it's a fun thing, because if you're passionate about helping people, which is clearly at the heart of who you are, and you desire to see improvement in the industry, but in individual people's lives, then as a leader, you're able to take that passion and allow it to help you in developing those leadership skills and building onto them as time goes by, because you're already starting from a place of deep care and respect for others. And that's a great start.
No, that's exactly right. And, I love what kind of comes with it too, is a certain level of creativity that we often don't think about whenever we hear the term leadership. But for me, it comes with that level of creativity where I'm actually able to build something almost from the ground up. And that is really exciting. I can kind of plan it, take it in different directions. I can pivot with it. And that to me is it's really exciting, because as a leader, right, you often think that you've got management, right? You've got delegation, right? You have all of those things that sound bureaucratic and boring, but there's this underlying current of creativity that I think gets missed a lot.
Yeah. I love that. I love that you highlighted creativity, because I think that makes everyone's lives easier, right?
Yes.
If you have that flexibility to, this is such an overused word, but to pivot. I mean, it's true. And so being willing to come at a problem or a situation with curiosity and go, I'm not sure that that's working the way I intended or hoped it would. And then go, okay, what are some creative solutions to this? And maybe that means looking outside of your industry too for ideas. I think sometimes you can get kind of stuck like, oh, this is how the industry is, and that this is what they do. And then we forget that, but that, that's not necessarily bad or wrong, but we sometimes forget that we can learn from all sorts of different sources and then bring it together and creatively handle a situation that we might not have otherwise been capable of doing.
Oh, exactly. And the other thing too that it's really done as well is make me a bit of a better lawyer, right? Because as a lawyer, it's interesting. There's always this tendency when something is going to either violate a law or not be the best in practice to say no to your client. And so for me, right, clients never want to hear the word no. And being a leader has allowed me to come up with some other creative solutions for my clients where I can say, okay, we can't do it the way you've proposed, but here's a different creative solution that I think could get around these key roadblocks. And so for me, with my clients, it's about trying to say, not that way, but this way, right? Kind of like a yes, but rather than a no. And I kind of take that same approach in leadership too, because I want to make sure that, with the people who are working for you and things like that, that you're making sure that you're meeting their needs as well. And so it's really caused me to adapt to kind of a yes, but framework rather than like a flat out no, we're done.
I love that. That's really cool. And that's a great example of how you can approach, again, a problem with that mindset of, okay, that will not work the way that you hope it will work. However, I've got an idea.
Exactly. It's so easy to say no, but coming up with those creative solutions, that's the fun part. That's really the rewarding part.
Yeah. Well, speaking of rewarding parts, I wonder if there are any moments that stand out to you along your journey so far of really affirming to you, wow, I am in the right industry at the right time in the right role.
Yeah. It's interesting. I think kind of the first instance of that I had. So I had a very unexpected women's health issue. I ended up with fibroids that were so large, I was the equivalent of 6 months pregnant, and they were crushing some of my internal organs. And I'm that person, right, who I go to my doctor every year, right? I get my annual, I get all my checkups and things like that. And somehow all of this was missed. And so whenever I had to navigate that journey as a patient, and I have all of this, obviously, advocacy experience, right? Legal experience. I'm navigating this at the height of COVID. I'm getting referrals and consultations with Mayo Clinic. I'm getting the best care that I can. And then seeing how even when you can do everything right, you can still be dismissed. For me, that was a moment in which I said, I'm not in the right industry at the right time, because at that point in time, I was still in big law and I wasn't doing anything really related to femtech. I had kind of resigned myself to not doing that. Just given some of the internal politics of the farm where I was at that time and their desire to not, expand into the health tech industry. And I had that experience and all I could think of was, this is not what I'm meant to be doing. I had this experience for a reason. And if I'm not going to make something out of that, what have I learned? Why did I go through this? That for me was the turning point to say, I'm leaving big law and I'm going to a smaller firm and I'm going to work on femtech. And I'm going to see where this pans out. It was so scary, right? Because you're leaving that high 6-figure job and something you're good at, the work you know, the people you're comfortable with, and you're going into something where you're making half as much money learning new industry. And I'd be lying if I say I didn't cry my first week on the job, because even as a healthcare lawyer, digital health law and health tech and med tech, all of that is so different than traditional healthcare. And there's so much to learn. And honestly, I felt like I was back at school in a course that I didn't understand for a week. So there's a lot of challenges with that. But fast forward a few years, we had unfortunately, the Dobbs decision come out. And that for me was really an affirming moment where I said, I'm definitely in the right industry at the right time, because I'm helping these companies build privacy practices and policies that are going to be protective of consumer data in this world. I'm helping to build an industry where women can get access to care in less traditional methods that won't compromise their privacy and their data. And one of the moments that stands out to me, one of the highlights, is I actually got to testify before one of the congressional committees on reproductive health data privacy. And, it was funny. I was actually on vacation at the time. I was in Greece and we were supposed to be on a ferry going from one island to another. And I had the night before, I get this request to come and testify on reproductive health data privacy. And I was like, yes, I'd love to. And of course, the timing was exactly when we were going to be on the ferry with no internet. So we actually had to charter a helicopter so that we could get over to the other island, get there, get me set up with the internet in order to testify. So that was kind of like my full circle moment where I really felt like I was having an impact and being able to even influence some of the policies in the future of reproductive health privacy. And then every day since then, I have just loved getting to work with these companies. And as we continue to see the trajectory of women's health in America, it's just really reaffirmed that we need people doing this type of work for me.
Wow. Oh my goodness. Well, first of all, wow, what powerful stories you are sharing. Oh my goodness, that is incredible. Thank you. Wow. I was like, so interesting how life works sometimes and the unexpected adventures that unfold. And I bet your creativity oriented mindset helped you even in that circumstance be like, okay, so we can't do the ferry. I know I need to do this. How do I make it happen? I don't know. Let's charter a helicopter. Cool.
It was definitely a moment, I tell you. It's one that has just remained in my head since then. It was just very funny when it happened.
That's amazing. I'm going to do this. I love it. Oh, my word. Okay, awesome. Well, gosh, this conversation is so good. I know I could probably talk to you for hours and learn so much, but I do want to pivot the conversation a little bit just for fun.
Absolutely.
So, okay, if you were to be offered $1 million to teach a masterclass on anything you want, it can be within your industry, but it doesn't have to be. What would you choose to teach?
Oh, I love that question. Oh, $1 million to teach any class that I wanted. I would probably create a class that would be, I would say it would probably be at maybe like the high school level, I'm thinking. Because whenever high school students go through those health classes, I would want to start early there for women to teach them all about the ways in which they can advocate for themselves and stand up for themselves at doctor's offices, right? Think, for instance, period pain that they're probably having there and thinking that's normal, right? Telling them about, how that's not normal, how that you don't have to normalize your symptoms and your pain. Here's how you can protect and advocate for yourself at a doctor's office. Here's how you can use the tech that's out there to protect yourself. Because even though, a lot of tech is for 18 up, we know a lot of teenagers are using, like period tracking apps are like the number 3 most used app for adolescents. So pretending it doesn't exist is not helping anyone, but we have to get to women sooner and empower them at an earlier age so that those lessons and that knowledge carries with them as they navigate the healthcare system for the rest of their lives. So for me, I think it would be a course that was really focused on kind of the early high school student, teaching them all about how you navigate not only femtech, but health tech in general, the healthcare system, how you advocate for yourself, how you have those conversations with your doctor without feeling embarrassed, and why that's so important.
Wow. Yeah, that would be a really powerful class and so needed. And I love the idea of starting that way, that would be a part of just education in general, so that,
Yes.
everyone benefits from that. It's a win-win when we advocate for women, help them understand how to advocate for themselves and how to protect their longevity, their health. That's really cool. I love that.
I would
I'll
love
take that
I would
class
love
too.
to do it. That would be a dream, really kind of creating a curriculum to incorporate it into health classes for high school students.
Ooh, maybe your next writing project.
There
not
we
that you
go.
need to do. When you find yourself bored at some point.
That's right. That's
Yeah.
right. Next week.
Right. Amazing. Amazing. Okay. And how do you wish to be remembered after you leave this world?
Oh, interesting. After I leave this world, I would love to be remembered as somebody who participated in the women's health movement. We think back, of course, like to the suffragettes, right? And, all of those amazing women who helped get us the right to vote. I want to be considered part of the women who helped get women's healthcare on the map with men's healthcare, right? That helped really spur this movement forward for women. So I don't even need to be remembered by name, right? But just as somebody who was involved in that movement and was very active in promoting women's healthcare and getting us to the place where women aren't being dismissed and we're being taken seriously.
I love it. Beautiful, beautiful legacy to aspire to. And you're already there. So that's an encouraging thing. You're working on that right now. That's
thank
amazing.
you.
Love that. And then final question. What is one thing that makes you smile every time you see or think about it?
Ooh, I love that. Ooh, okay. So one thing that makes me smile, I have so many things. I'm usually not smiling. Okay, so I have a couple. Honestly, I'm a huge pet lover. So my dog, we're getting to the point where they're a little old now. One of them's 15, one's 13. But any kind of animal, pet, especially little puppies, I love. So that's something that makes me smile all the time. I will say I also have a slight obsession with books that have sprayed edges, which is becoming a major thing now. So it's really cool. But there's actually artists who will paint the edges of books, and I'm a huge book lover. So I actually have a library of sprayed edge books that I just love looking at, and they make me smile all the time to see the different artists and artwork on the bookshelves.
That's awesome. Oh my goodness. Yes. Well, I can relate to all of that. And yeah, that's so fun. I love that too. Animals always make me smile. I mean, it's like a running joke around people that know me. It's like, okay, if you bring an animal around, I'm going to be like, can I hold it? Can I touch it? Like instantly.
I've already warned my family. I'm like, if you guys die, I'm sorry, but I'm going to have 10 pets. Like, it's just going to happen.
Yeah.
I'm not going to be able to control myself.
Right. It just, that's what happens. I get it. Oh, my word. Well, this has been such an amazing conversation. I'm so thankful for you and for your time today. And gosh, just sharing so much practical advice and insight and your journey. So first of all, thank you so much for doing the work that you're doing, for being in this industry, for pushing it forward, for being somebody who is a pioneer and your own version of suffragette. And I really love what you're building, and I'm so thankful you're doing this work. So gosh, I just wish you the most continued success as you continue to work to change lives for a better world.
Oh, thank you so much, Lindsey. This has been so great talking with you and sharing the knowledge. And I'm so hopeful that we can push this industry forward together because we do have the power to change it. We just have to act on it. So thank you so much for helping to spread the word.
Absolutely. Amen to that. And thank you so much to our listeners for tuning in. And if you're feeling as inspired as I am right now, I would love it if you would share this episode with a colleague or two. And we'll catch you next time.
The Leading Difference is brought to you by Velentium Medical. Velentium Medical is a full-service CDMO serving medtech clients worldwide to securely design, manufacture, and test Class 2 and Class 3 medical devices. Velentium Medical's 4 units include research and development, pairing electronic and mechanical design, embedded firmware, mobile app development, and cloud systems, with the human factor studies and systems engineering necessary to streamline medical device regulatory approval. Contract manufacturing, building medical products at the prototype, clinical, and commercial levels in the U.S. as well as in low-cost regions in 1345 certified and FDA-registered Class 7 clean rooms. Cybersecurity, generating the 12 cybersecurity design artifacts required for FDA submission. And automated test systems, assuring that every device produced is exactly the same as the device that was approved. Visit ValentiumMedical.com to explore how we can work together to change lives for a better world.